Hello everyone and welcome back. My name is Gwendolyn Halle. I'm a medical microbiologist, popularly known as the medical professional with the difference, and I bring you knowledge on health, medicals, hygiene, farming, business, and a lot more. Today we are going to talk about the causes and treatment of a Sunken Fontanel or soft spot in a baby. Before I go in, I would like to define what a Sunken Fontanel is or soft spot. It is that undeveloped area, that space in a child's skull where the bones of the skull are still to develop. So sometimes you see when a baby is born, you see it's when he or she is breathing, you see the space, vibrate a little bit, and some babies it moves up and down, it moves up and down. Now, mothers should take care, or people should take care. Do not press that area down. Now, when some mothers see this, they begin to panic. Some of them begin to use herbs. Some of them think it's witchcraft. Some of them take their fingers and try to put the ceiling of the baby's mouth and try to see if they can push the fontanel up. Some turn the baby upside down to see if the fontanel could level up, but that wouldn't work. There is one main cause of a sunken fontanel in babies, or a sunken soft spot in babies, and that is dehydration. And under dehydration, we have two roots of dehydration. Dehydration that could be caused by the mother not drinking enough water while breastfeeding the baby, and dehydration caused by diarrhea. Now, what is the treatment for a sunken fontanel? Or what are the treatments for a sunken fontanel? Point number one, make sure that the mother is drinking enough water to be able to supply water in her breast milk, through her breast milk, to the baby. And if the mother is not breastfeeding, she should be giving the baby mineral water, not just instant meals with water, but actually mineral water to drink. And especially if they are living in a very humid or hot condition, because the baby perspires, the baby will pee a lot and will lose a lot of water. The next point of treatment is try to see if you can treat the diarrhea. Try to go to the hospital and see if you can stop her from passing out watery stool and vomiting by giving, if the doctor prescribes medication, yes, or most probably the baby will prescribe some electrolytes. And you could also make your own electrolytes at home. You could take some water and then you add a bit of salt and you give your baby to drink, and that will act also as an electrolyte to actually hydrate your baby. If you want to prevent your baby from having a sunken fontanel, what you have to do is keep drinking water. As a breastfeeding mother, give your baby water, because I hear some mothers say that their doctors or their midwife says water, mineral water, pure clean water isn't good from the baby at birth. I would disagree, because the baby needs water, especially if the mother doesn't breastfeed the child, doesn't drink enough water, and she's given the baby instant milk, or let me say formulas or all that. The baby will need water. And if the baby is living in a very hot or humid environment, please give your baby water, mineral water, clean bottled water. That will prevent the baby from having a sunken fontanel. And also make sure you give your baby clean food. Make sure you boil your baby's bottles and all that. Try to reduce any form of infection, bacterial infection, or fungal infection that may cause bacteria to the baby and that may cause diarrhea to your baby and lead to dehydration, and that will lead to a sunken fontanel. Well, we've come to the end of our short teaching today. If you have any questions, please do pop it down below. And if you're joining this channel, I would like to say you're welcome. Do join and turn on the notification bell so you get new updates on new health tips on a lot of issues, embarrassing issues, common issues that we are facing. And if you are a returning subscriber, I'd love to say thank you. God bless you. Bye-bye.